Hello, my name is Stacey Zhang, and this is communications class. My purpose of my speech is to inform my audience or watcher about addiction and the brain development. The brain is the most important part in our body that makes us humans function correctly. So, addiction can create unwanted or wanted impulses. The four subjects I will cover in my speech in order is obsessive compulsive disorder, gambling, alcohol, and drugs. At the end of my presentation, my audience or watcher will have a better understanding in addiction in the brain development. OCD, or known as obsessive compulsive disorder, patients diagnosed with OCD have exposed avoidant behavior to reduce their stress and anxiety. Premature exposure of avoidance can add criterion in the future. The basal ganglia is a structure in the brain that can influence both motor pattern generators in the spinal cord and neurocognitive pattern generators in the cerebral cortex. There is a chemical imbalance in the brain that causes OCD behavior. It can be both psychological and biological. OCD causes pathological obsessions that take over individuals' thoughts. They're intrusive and often appear meaningless, inappropriate, and irrelevant. If these obsessions continue to occur, the obsessions will become more complex in the future. OCD mainly occurs in children and adolescents. OCD can cause a change in diet or an amount of weight loss. Patients who are diagnosed seek cognitive behavioral therapy or they have to continue, and then medication is also treatment. Secondly, gambling. There are various and different substances, activities that contribute to complications in the developing brain. Gambling is one of the negative activities that can harm the developing brain. Asynchrony in developmental times courses between the affective approach and cognitive brain systems, as well as ongoing masturbation and neural connectivity, are thought to lead to increased vulnerability for risk-taking adolescents. Medication for gambling has been more effective than strategies for taming compulsions. Gambling addictions can vary from poker to slot machines. Quick money or easy money is usually the thought of a person who is addicted to gambling. Alcohol. 1/3 of high school students are reported binge drinking. Alcohol induces memory impairments, also known as blackouts. They are often found in younger drinkers that can cause disruption in neuroplasticity and the effects of learning, memorizing new information in the prefrontal cortex and hippocampus. Abnormalities of neural growth patterns in heavy drinking may contribute to short-term memory and negative effects on cognitive, social, and academic functioning. Alcohol on brain gives a toxic effect in development of the central nervous system. The highest heavy drinkers are college students, which is not surprising. Alcohol causes poor judgments in someone's behavior. People who are alcoholics tend to take it out on their family and cause abusive behaviors also. Last, drugs. Drugs are pre-exposure that can lead to one having an enhanced CCP, resulting in the users to have drug-taking behaviors. The use of cannabis in younger people can cause various cognitive impairments, harming the brain development in younger users. The brain can be remodeled after exposure to drugs, resulting in various problems with the development to the brain in younger people. Drugs tend to be the most difficult to recover from. It takes many years of therapy to overcome. In conclusion, addiction and the brain development can influence many unwanted or wanted behaviors that people cannot control. It is important to help people who are struggling with addiction and educate them in the future. The brain development grows continuously throughout lifespan. Patients diagnosed with types of addiction need treatments as soon as possible, or it is too late. Thank you. The end.